Medicaid is one of the great boondoggles in American public policy. We expend literally hundreds of millions of dollars a year. We expend literally hundreds of billions of dollars a year on Medicaid, and the returns on Medicaid are truly atrocious, just in speaking in terms of public policy, speaking in terms of health outcomes.
Ben Shapiro was on his show railing against Medicaid. Emma Vigeland of The Majority Report broke all this down. We're going to take a look at clips from The Majority Report with Emma Vigeland. I'm going to share my thoughts on this too. Let's get into this together.
Some blue state Republicans are trying to sound the alarm to Donald Trump about these Medicaid cuts because he's saying publicly, and I guess there are some people that believe Donald Trump at his word at this point, which is shocking to me, because he's probably the most notorious liar in American history. He's saying that he doesn't want to cut Medicaid, but the Republican House budget slashes Medicaid to the bone. Now, there was a piece in the Washington Post today that Representative Jeff Van Drew, he's a Republican in New Jersey, which is a blue state, is talking to Trump, among other blue state Republicans. Hey, you know, Medicaid provides health coverage for like 1 in 5 Americans, 41% of births nationwide, basically half of coverage and care, or at least it helps around half of kids with special needs. 83 million low-income Americans are a part of Medicaid programs. 5 in 8 nursing home residents. I mean, this would be so devastating for our elderly in nursing homes. And it's more, there are 41 out of the 50 states in this country have Medicaid expansion. There are 9 Republican states that still resisted it. That was a part of the Affordable Care Act, where essentially the federal government pays for all of it, and then they split the administrative costs, the federal government and the state government. So like, it's barely skin off the back of these red states. But this is the policy of conservatism. This is their ideology. They want to immiserate people so that they continue to be in the workforce and can be exploited. And they can transfer more wealth to the top of the income threshold. So Ben Shapiro responded to this and talked about Medicaid. It's been a fun kind of year and a half to watch Ben Shapiro struggle in the Republican rebrand of being economic populists, which is not a thing, but they try to pretend they're for everybody. And you have Ben Shapiro chiding people for celebrating the death of that United Healthcare CEO. And most of his audience is like, wait, I'm on board with this. And then I'd be curious to see how his audience responds to this kind of thing, this kind of coverage of Medicaid, because almost everybody knows somebody who or has been on Medicaid, because 1 in 5 Americans benefit from it. This is Ben Shapiro's take.
So the House Energy and Commerce Committee is responsible with coming up with $880 billion in the savings. But the reason the Democrats are saying that's all coming from Medicare and Medicaid is because the House Energy and Commerce Committee presides over programs like Medicare and Medicaid. So House Minority Leader Hakeem Jeffries, he, of course, is suggesting that's exactly where all the cuts are going to come from. They're going to come from Medicare. They're going to come from Medicaid. They're not going to come from Medicare. President Trump does not want any cuts to Medicare. Medicaid is a bit of a different story, and we'll get into that in a moment, because the truth is Medicaid is one of the great boondoggles in American public policy. We expend literally hundreds of millions of dollars a year. We expend literally hundreds of billions of dollars a year on Medicaid, and the returns on Medicaid are truly atrocious, just in speaking in terms of public policy, speaking in terms of health outcomes. There's some good studies that actually demonstrate that Medicaid coverage is no better than you having no coverage and just going for emergency care to the hospital. Why? Because the reimbursement rates on Medicaid are so low that doctors don't even take Medicaid. Good doctors don't like taking Medicaid because the reimbursement rates are pennies on the dollar of what they could earn from private insurance.
Pause it. Good doctors don't take Medicaid. Why is that the case? Why do we have tiered healthcare in this country? I mean, he's just being factually, he's correct that there are only certain doctors that take Medicaid, and that's a part of our tiered healthcare system where the wealthy get to benefit from private insurance and top doctors, and doctors who take Medicaid. Yeah, they're maybe more used to taking more low-income patients, and perhaps the care quality isn't as good. That's the problem of an underfunded healthcare system where we have mostly privatized it all. And so Medicaid, a government program, has to compete with the private insurers that are gouging people. I have a proposal for the Department of Government Efficiency and the Republicans who are looking to cut out waste, fraud, and abuse they falsely tell us in our government. How about we make it illegal for there to be a private middleman mafia boss in between us and our healthcare, and make that universal across both income thresholds, if it relates to Medicaid, and disability, and age when we're talking about Medicare.
Because actually, when you talk about bad cost value for money, it is our private health insurance system and our collapsing life expectancy because of that.
And so cutting out waste, fraud, and abuse would mean maybe just make us have one payer, the federal government, for our health insurance. And you know how much costs would go down? Exponentially.
And Emma Vigeland is exactly correct with what she's saying here. But this is the problem. And I mean, we all know this. There's no secret here. But for right-wingers, so-called conservatives like Ben Shapiro, they, the idea is we're going to cut out this waste, fraud, and abuse so that we, quote unquote, we can save money. And then what happens? Is that money going to be used to benefit Americans in some way? No. Are they going to take those savings and, Ben Shapiro says, okay, it's horrible, it's a boondoggle, Medicaid, that is. Does he propose any alternative system that would be better? No. The fact is, they don't, once this money is saved, quote unquote, they just want this to go back into rich people's pockets. They just want tax cuts. That's all. It's like when they talk about how they want, let's stop fighting these wars overseas so we can spend that money here at home. They don't want to spend that money here at home. Spend that money here at home is tax cuts going into rich people's pockets, or staying in rich people's pockets. They don't want to spend that money here either. Ben Shapiro, he's talked before about Social Security and pensions and all that. His view of America is, unless you're rich and you can save up enough money through investments or whatever that you can retire, you just work till you die. There wouldn't be any Social Security. There wouldn't be any pension through companies. And your healthcare system is whatever healthcare you can afford to pay for. If a procedure costs $1 million and you don't have $1 million, well, sucks to be you. Maybe you die. Or maybe you're in debt for the rest of your life, in massive debt. That's Ben Shapiro's healthcare plan for Americans.
So what he's talking about poorer outcomes for Medicaid, which isn't borne out in reality when he says it's better to have no coverage than to have Medicaid coverage, is what he just claimed there. Better to have no coverage than Medicaid coverage. You're serious? If you go into the hospital with a Medicaid card with an emergency, I'm not saying that you're going to be able to have it all covered, but if you go in with an emergency and no health insurance, it could bankrupt you for the rest of your life. What he's saying is completely verifiably false. But then he does that little shift, you can tell, right? When he says the good doctors part. That's when you know he's lying to you.
I mean, he's just trying to gaslight his audience. He's trying to gaslight his audience to get them ready for losing their Medicaid. You're seeing this at Republican town halls across America, telling people that, like, oh, yeah, you might experience some difficulties, but don't worry, it's actually not so bad. And, because he knows his audience, some people in his audience statistically have to be on Medicaid, and they're going to experience that. And he wants them to, have this in the back of their head when they're forced to try to find some way to pay for their health care.
Right.
And family members are going to have to pay for this stuff for seniors, the 6 and 10 that Medicaid covers for nursing home residents.
That's exactly right. And the nursing homes are increasingly being bought up by private equity that are cutting nursing services and healthcare services to extract as much money as possible. So when we talk about waste, or we talk about how we could improve Medicaid, in part, it's because this money is going towards these private entities that are exploiting government services for profit and not giving our nursing people in nursing homes the right amount of care.
Well, I mean, it's a bit of a conundrum now, isn't it? Right? Because when you talk about the administrative cost of social programs like a Medicaid, like anything that you're not spending in their minds literally on care must in fact be waste. And we know that's because ideologically they view the whole thing as wasteful. But when like a private company has like 5 times the administrative cost, that's not like waste. That's just like profit. That's profit for them. That's revenue. Like the,
Right.
the government doesn't like operate that way. So it's easy to frame like any spillage as like waste. But in the private sector, like, all of that, like all those profits that people tout, like that's the waste for you. Like that's them wasting your money.
Yep.
And for anybody listening, I have a lot of viewers who are outside of the U.S. So the difference between Medicaid and Medicare. So Medicaid is for lower income people. Medicare is for senior citizens. It's the healthcare for them. But senior citizens, once they get to a point where they go into a nursing home and they have to have, their family can't care for them anymore, and they have to be in a facility, basically all of their, they basically sell off their assets, and then they go on to Medicaid, so the lower income coverage to cover their time in the nursing home, which can be incredibly expensive. There's hardly anybody except the very wealthy who can afford that. It can be $10,000, $15,000, $20,000 a month, and people can't afford that. So the Medicaid covers that. And people have been talking. So what, the Republicans are trying to do is cut $880 billion from Medicaid. And then you get into a thing where you have a ripple effect that, the average person isn't thinking about that. They just say, oh, I don't like those poor people. So cut that Medicaid. I don't get that. Well, you go in and cut that Medicaid, and now you have facilities that have to close. Now you have nurses who lose their jobs. So now there are nurses in your community who are out of work, and there are facilities that are closing, and those are people working there. These are the things that most people don't spend a lot of time thinking about, the economic impact that we're going to be facing in our country with all of these jobs cut, all of these programs cut. But let me know what you think about what Emma Vigeland and the rest had to say on the Majority Report, Brendan and Matt Leck. Let me know in the comments what you think about all of this. Make sure to give me a like and subscribe. This is Chris on Culture, and I will see you in the next video.